If anybody's here would like to speak, we'll give you the opportunity. If not, we'll move on. Next item on the agenda is item number 6, special recognitions and presentations. And we have a presentation as information on the trauma cases and NICU admissions. And we have Mr. Tim Bradshaw, Ms. Danny Cook, and Dr. Mickey Spivey. So you're welcome to come forward. And welcome.
Good evening. I appreciate the opportunity.
Make sure, I'm sorry, Dr. Spivey, is your microphone on?
Is that on?
Thank you, sir.
Okay. I appreciate the opportunity to speak with you guys tonight. I'm Dr. Mickey Spivey. I am an emergency physician who's practiced emergency medicine in Kingsport for the last 30 plus years. During that time, I have been extensively involved with EMS, fire, rescue, dispatch. I'm currently in the part of my life where I'm doing volunteer work only, but I continue to be heavily involved with the pre-hospital care and emergency services in our region. I'm here tonight because I actually believe that all of us in our region deserve the best chance of survival if we're faced with a major medical or trauma emergency. I feel that the Ballad Trauma Plan, with the downgrade of the Bristol Regional Trauma Center and the Holston Valley Trauma Center to level 3 trauma centers, is too drastic of a change for the safety of the people of our region. I think we all know that trauma centers save lives, reduce morbidity, and improve outcomes, but this is provided that definitive care can be obtained within the first 60 minutes of injury. That's the golden hour, and the American College of Surgeons states the risk of death can be decreased by 25% if folks can receive definitive care at a level 1 trauma center within the first 60 minutes. Timely access to care is absolutely crucial. Rural trauma accounts for 60% of all trauma deaths. Timely access to definitive care is very important, but very difficult to achieve in our area. We have a large Ballad service area of almost 21 counties. Our mountains, our valleys, or hollers and stuff, or winding roads, we all realize that in combination with weather make it the ground transportation and air transportation in our region much less effective than in many other parts of the country. And in Tennessee, 80% of the patients that arrive at trauma centers actually arrive by ground transport. Because of this, I think that all of our trauma centers are needed to ensure the timely access for critical care. Now, the map that you see, can you guys see if I actually, I don't guess you can see up here.
Yeah, we have screens up here, Dr. Spivey.
Oh, okay. The part that I wanted to point out is I know that that's very small and hard to see, but if you look, you can see where Johnson City is located, kind of in the lower part of the area here. Then you see Holston Valley, and you see Bristol Regional Medical Center. I think it's very important that we look at that area and look at Holston Valley Trauma Center, Medical Center's service area, and it's basically the 11W Highway 23 corridor, okay? And then as we know, Bristol Regional's primary service area is the Interstate 81 corridor in the Virginia counties that are associated with that. If you look at those two large areas, you will note that over 2/3 of that Ballad service area is closer to another hospital than it is to Johnson City Medical Center. And because of that, it's extremely important that I believe that we maintain the quality and the strength of those hospitals in Kingsport and Bristol to better serve the people in those outlying portions. It's important that you understand the Tennessee Trauma Center levels. In Tennessee, there's 3 levels of trauma center. Level 1 is basically the highest level of trauma center in Tennessee. It has the most requirements, and per Tennessee definitions, it basically provides optimal care to the acutely injured trauma patient. A level 1 trauma center requires 28 specialties to be on call 24/7. And of those 28, 11 of those specialties are medical specialties. A level 2 is very similar in capabilities to a level 1. They have similar facility requirements, and by definition, they also provide optimal care to the trauma patient. They require a few less specialties than a level 1, with only 24 specialties having to be available 24/7. And like the level 1, 11 of those 24 specialties are actually medical specialties. Then we have a level 3. A level 3 is the lowest trauma center level in the state of Tennessee. And compared to the 28 specialties for a level 1 and the 24 for a level 2, you can see the level 3 trauma center only requires 4 specialties. It's a huge difference, okay? And of those specialties, neurosurgery, orthopedics, and radiology are not even required to meet the criteria for a level 3 trauma center. The American College of Surgeons resources for the optimal care of the trauma patients basically states that a level 3 trauma center is generally not appropriate in an urban or suburban area with adequate level 1 and level 2 resources. Ladies and gentlemen, Bristol and Kingsport, Holston Valley and Bristol Regional had greater resources than a level 3 trauma center requirements over 30 years ago. So we're taking a drastic step backwards. This list that you see there is basically just a tabular form of the requirements for the various centers. A level 1 is the first column that you see, and it shows again the 28 specialties that are required. The second column is level 2 with the 24, and then the last column is the level 3, and you can see that there's only 4 specialties that are required. A level 1 and level 2 trauma provides far more than just surgical or trauma care. It provides 11 different medical specialties that have to be on call. Cardiology, pulmonary medicine, gastroenterology, hematology, infectious disease, internal medicine, nephrology, pathology, pediatrics, psychiatry, radiology. These are all requirements of a level 1 and level 2 trauma center. A level 3, however, only requires 1, and that's internal medicine. I think it's pretty easily seen that the level 1 and the level 2 trauma center requirements actually help ensure far more than trauma care availability. It also helps to ensure that high quality medical care is available 24/7. And ladies and gentlemen, that's really important to these folks that we are talking about in these Virginia counties that we're talking about, in the 81 corridor, the 23 corridor for Holston Valley and Bristol Regional Hospital. So why in the world would we downgrade a level 1 or a level 2 trauma facility to a level 3? Well, Ballad Health pays specialists to be on call. They also pay or hire locum tenens coverage, which are kind of, forgive the expression, but kind of rent-a-docs. These are traveling specialists that come in to help provide specialty coverage when a specialty is not going to be available for several days. Okay, so Ballad actually pays for locum tenens coverage, and they also pay for specialists to be on call. I think you can see that the minimal requirements of a level 3 trauma center, with only 4 specialties being mandated, significantly decreases Ballad's obligation and therefore most likely decreases their cost. My concern, however, is that the cost to the patients may be extremely high. The comparison here, again, just kind of reiterates what we were talking about. The differences between level 1 and 2 and a level 3. 28 and 24 specialties versus 4 specialties, 11 medical specialties versus 1 medical specialty. I think it's pretty obvious the significant downgrade here. But what does that mean to you guys? This is where it's really important to understand. With a downgrade to a level 3 trauma center at Bristol Regional, even though you're outside of Tennessee destination guidelines, Virginia has similar destination guidelines. And it basically states they use a little different scoring than we do in Tennessee, but it basically states that if they have a revised trauma score of 11 or less, or a Glasgow Coma scale of less than 13, those patients are priority 1 patients and are to be directed to the closest level 1 or level 2 trauma center. Your closest level 1 or level 2 trauma center currently is Bristol, okay? But if Bristol now is downgraded to a level 3, your closest level 1 or level 2 hospital is going to be Johnson City. So that means that folks that are injured here in Washington County, Virginia, that meets those requirements, but from the Southwest Virginia EMS Council, they are going to have to be transported to the closest level 1 hospital, and that's going to be Johnson City, okay? Now, what if MedFlight, it also says that basically if that transport time is greater than 15 minutes, they should be actually flying these patients out of here, okay? What if MedFlight isn't available, okay? If MedFlight isn't available, then you're going to end up calling the Ballad helicopter service, and that, ladies and gentlemen, is a very costly operation, okay? I asked Ballad to give me an estimate on the average cost of a helicopter transport in the region. They told me they would get back to me, and I haven't heard that, okay? But if you look at the National Association of Insurance Commissioners, they say that the average range for a cost for a helicopter flight is anywhere from $12,000 to $25,000, and I've certainly heard even worse here in our region. That's a significant cost to our people. I also believe, though, that, if those helicopters aren't available, and we all know that many times the helicopters simply can't fly, then that means that your local EMS units are going to have to transport these patients now instead of Bristol and back. They're going to have to go to Johnson City and back. That takes those valuable EMS resources out of your community for an extended period of time. And if your agencies are like many of ours in Tennessee, they work at capacity or near capacity almost every day. And taking that unit out of service may mean that other emergency calls locally may have a delay in response. That places everyone in your county, in your region, at risk, and I do not think that's acceptable. We've also heard from Mr. Levine and the Ballad marketing team that 90% of all of the trauma care will still remain local. It means it'll still remain in Bristol, okay? 90% is still there. You tell me, folks, how in the world do you still provide quality, high-quality trauma care like you have before to those remaining 90% of patients when you have an 83% reduction in the number of specialties that must be available 24/7? It doesn't add up. I also think that you will understand when they talk about call centers. They're really proud of the call center, and actually, it's a good idea. But the call center today is not really required. And it's not required today because all of our EMS agencies know that each of those trauma centers, Johnson City, Kingsport, and Bristol, all have a full complement of available specialties 24/7. They're mandated. They have them 24/7 unless those agencies are notified otherwise. However, a call center is an essential component for any hospital system that plans not to have all specialties available 24/7. I also think that you will see as specialties begin to decrease, their specialty availability begins to decrease locally in Bristol, that what's going to happen is if you come into the emergency department and I should happen to see you and maybe you've fallen and you've got a fracture of your face, okay, a facial fracture. I can take care of you during that evening. You don't need to be admitted, but you need to have specialty follow-up the next day. If those specialties are not available locally, where do you think they're going to probably be available? At Johnson City. So we're going to see more and more times that next day follow-ups and stuff are also going to have to go to Johnson City, which has placed some difficult traveling problems for our people in our region here. But this is something that I think is extremely important that you need to understand, is reduced redundancy. Ballad says that they are out to try to reduce duplicative, expensive services. That is great for business, but it's lousy for life-saving emergency care. Redundancy is important, and what I mean by that is this. Today, if we have a serious accident down here at exit 7 or exit 10 or whatever, you pick it, okay? And we have multiple seriously injured patients that meet these level 1 criteria. Okay, so we have 6 or 7. That would overwhelm any of our single level trauma centers. It's going to overwhelm Johnson City if it's the level 1. But today, because we have redundancy and capacity and capability to deliver high quality care at both Bristol and at Kingsport and at Johnson City, that large number of people can now be dispersed to all of these trauma centers so that everybody gets timely access to critical care. With a level 3 in Bristol and a level 3 in Kingsport, that simply will not be available. And I think that all too often we kind of forget or kind of take things for granted. We've been very blessed for not to have had a major mass trauma casualty event or a disaster here in many, many years. We've been blessed to have developed many life-saving, wonderful resources here in this region. But if those specialties begin to go away, those resources begin to dwindle. And then when we do have that event, those specialties and those capabilities are simply not there. And that's hugely important for those of us who are involved in emergency preparedness. I think that it's also very easy to see that with the decreasing number of specialties available at both Kingsport and Bristol, that it has the potential to significantly have adverse economic effects for both of those cities. I want you to take one last look at this thing, and I'm almost through. Is that Ballad basically says that they're creating a fully integrated, highly coordinated, comprehensive regional trauma and emergency system to better the needs of Northeast Tennessee and Southwest Virginia. The map is in front of you. Our current trauma system, which Ballad says we really don't have, it basically consists of 2 level 1 trauma centers and a level 2 trauma center, all providing high quality, high level trauma care, all appropriately located to improve the timely access to definitive care in all of the region, as we pointed out before. They propose, however, to change that to having a single level 1 trauma center poorly located in the region to serve the region, and 2 level 3 trauma centers in Bristol and Kingsport. Ladies and gentlemen, there is no way that you can convince me that that's improved trauma care locally or for the region as a whole. What I would like to suggest here is that there is a solution, okay? I think that going from a level 1 or level 2 to a level 3 is just far too drastic. I think the compromise that would actually work is to actually maintain Bristol as a level 2. Could reduce Holston Valley from the level 1 to a level 2. So now you've got a level 1 in Johnson City, but Bristol and Holston Valley remain level 2s. Level 2s are strong, capable trauma hospitals, but they're also strong, capable medical centers, partly because of these requirements. This, I think, folks, would actually make the Ballad Health Plan work, and I actually believe it would do what we all want it to do, and that's to help save lives. You know, I read in an article in the Kingsport Times News here, and it was from the Scott County Board of Supervisors, and it was just a comment that was made by Dr. Redwine over there. And it talked about that Virginia senators and other elected officials are continuing to monitor the situation. It says they have no decision-making power with Tennessee corporations, but they are obligated to protect and to try to represent the people of Virginia. I think that's an extremely powerful statement. And I want to leave you with this one thought here tonight. I truly believe that for the last 30 years, the people in their region have had that best chance of survival possible if they're faced with a major medical or trauma emergency. In my opinion, they deserve no less tomorrow. So I appreciate your willingness to serve, and I appreciate your willingness to listen, and I'll be happy to entertain any questions at whatever time you would like. Thank you very much.
Thank you, Dr. Spo. Is there any, if you stay right there, if that's okay. Any questions or comments from the board?
I've got just a couple of questions here.
Yes, sir,
if I
Mr.
could. One, your map up there, what was the northernmost county that it represented? Did it go all the way to Wythe County?
Yes, it does. It's and you'll have to forgive me a little bit for the Virginia counties, but it does go up to Wythe and to Bland. And you know what you're already seeing in Bristol here is that Bristol is already actually seeing a reduction in some of the trauma patients because of Pikeville, Kentucky, a few years ago established a level 2 trauma center in Pikeville. Okay, so some of these cases that they were getting from Buchanan County and the upper counties there now are actually going to Pikeville because it's actually closer transport time by air to Pikeville than it is to Bristol Regional. And so if this happens and Bristol is downgraded to a level 3, you're going to see even more decrease in trauma patients coming to Bristol Regional Hospital.
Now, my second question was, where would be a level 1 in Virginia? All the way to Roanoke?
Roanoke. That's your closest level 1 hospital, and your closest level 2 hospital in Virginia, if I'm not mistaken, is in Blacksburg or Christiansburg in that region. I do have a map that shows that if you'd like to see it.
I just wondered where, if we didn't go to Johnson City, where would we have to go? We'd have to go all the way
It
to
would be Roanoke. Roanoke would be your closest level 1 or 2 trauma center.
Thank you, sir.
Yes, sir.
Any more questions or comments? I have a question that maybe, I'm not sure if But you said there was 28 specialties at level 1, 24 level 2, 11 of which were medical. What's the balance? If they're not medical, what?
They're surgical. They're surgical.
Differentiate. I'm sorry, I'm a novice.
Yeah, they're actually
surgical and medical.
Correct. Yes, sir. And I actually have a handout there that'd probably be a little bit easier to read. I apologize for this. I tried to put it together myself and didn't have my grandkids to help me, so, I'm a little bit challenged there. So,
all right. Thank you. Any other? Yes, sir.
Yes, sir, they are. In fact, Holston Valley is staffed to be a level 1, and Bristol is a level 2, and they are staffed to do so. So, and that's just it. We have all these resources that we've accumulated and developed over 30 years. It's a shame to see them wasted.
Okay. Anything else? Any questions? Okay. Thank you, Dr. Spivey.
Thank you very
for being
much.
Here. Okay, with that, we'll move on to the next item on the agenda. And I believe we have some handouts. Oh, we have another presentation?
I won't be I'll kind of snip it down so you guys can just review the information. This is for the NICU portion.
Okay. Yeah, I wasn't aware. Okay. Well, we'll do that. We'll let you present. So it's not going to be as long as the other presentation.
No. And I've got handouts so you can just refer to it at a later date and time. One of the things that I want to open up with is just the COPA agreement. You hear a lot of talk about, well, the COPA has been approved. There's nothing that can be done. And I want you to take a look at the second handout that's in your folders. You don't have to look at it now, but on the second page, what you will see are some distinctions that are very important for you all to remember. You still have power and you still have the ability to protect your people. The last bullet on page 2, it's bullet 7. It says nothing in this COPA. Well, let me back up to bullet point 5. This COPA is subject to termination if the department determines that the benefits resulting from the cooperative agreement no longer outweigh any disadvantages attributable to a reduction in competition that may result from the cooperative agreement and the modification of the COPA is not obtained. This COPA can be modified and it can be terminated if we are able to show the State Department of Health that the disadvantages to our citizens and to our residents in this community are far outweighed than the advantages of them having this merger and pretty much a medical monopoly. There's a map also that's in here that shows you the coverage area. What you'll see is that Ballad controls about 78% on average of all inpatient care in this area. That's a significant amount of power to have, not only over patients, but over employment in this region. So those are things that I want you to keep in mind when you think about what you can or can't do about an existing COPA. And it's coming up for annual review in January and February. They have to announce it 3 weeks in advance, and you can attend in person, which I plan to do. I'm going to leave the rest of that for you guys to look over later. I want to get to the part about the NICU and why this is significantly important to you. Doing research, I actually had a grandbaby born at the Holston Valley NICU about 18 months ago, weighing 1 pound and 3 ounces. Holston Valley Medical Center's level 3 NICU saved her life. It's why I'm so passionate. It's why I'm here. And it's why I would love to have your attention in your ear and hear the concerns that I have. Southwest Virginia gets hidden in Virginia statistics a lot. I'll give you an example. The infant mortality rate for the state of Virginia is 5.9, which means 5.9 babies die out of every 1,000 births in the state of Virginia, which sounds great because the national average is 5.8. The problem with that is Southwest Virginia is extremely higher than that, and Washington County is 12.9. 12.9 of your babies out of every 1,000 die. And if you close a level 3 NICU that's at Holston Valley Medical Center, and you leave Niswonger Hospital as your only option, that number will rise. It has no choice but to rise. And I think that babies deserve a better chance than that. I want to give you a little bit of information also about your opioid crisis that we have in this region. All of you guys are aware of it. All of you all are. So listen to me. I have done some studies from the National Library of Medicine, the National Health Institutes, and what they will tell you is that premature birth could be considered a traumatic event for moms and dads because their life is in danger, the life of the mother is in danger, and so is the life of the baby. That qualifies for a traumatic incident, which oftentimes leave these parents with PTSD symptoms. They can have avoidance syndrome. They can have hyperarousal. NICU moms already have a higher proportion to postpartum depression. When you think about that and think about your baby being an additional 30, 40 hour away, it's only going to cause a greater feeling of hopelessness, powerlessness. The relationship between parents and NICU staff is essential. You have to know that you can trust the person who's caring for your baby. You have to know that your concerns are being heard. You don't want to go through life saying, "Oh my gosh, my baby's this far away." You just don't want to do that. It takes parents even after 30 days. I can tell you right now, my Google Photos cannot index pictures of my grandbaby earlier than 6 weeks because she's not recognizable. That in itself is oftentimes traumatic for parents. They look at their babies and they don't look like babies. And they have to digest all of that. That's before we even talk about the poverty levels of this region, which you and I know are 20 to 40% depending upon where you are. Who in this area has the transportation, who has a job that will let them take off? I've given you information about kangaroo care, which is skin-to-skin contact for babies. It is shown to be super effective in helping our babies develop and heal. What we know is that babies that are in the NICU who do not have their parents around, they are greater to illnesses, they are greater to complications. Their time in the hospitals are often extended, actually. So the money that Ballad thinks they would be saving, it's going to be at the expense of all of your residents, because those medical costs are going to come out of their pockets and out of the pockets of their insurance. And you guys simply, we cannot afford it. You just can't afford it. I wanted to point out this because you hear Mr. Levine talk about volume. There's a handout that's in your, I want you to look at it when you have time. It's the second paragraph from the bottom. You hear him talk about volume. Volume means better care. Well, it doesn't if you're understaffed and you can't take care of them, right? That's the first thing that I would point out. The second thing is, when he quotes the American Academy of Pediatrics, when they refer to volume, they're actually talking about very low birth weight babies, which are babies that are less than 3.3 pounds, under 1,500 grams. That same study, this is what it says. Other studies assessing NICU volume suggest caution in using this measure as an effective indicator of quality care. The reason why is they found that although annual volume explained 9% of the variation in hospital mortality rates, other hospital characteristics explain another 7%. Low weight babies, very low birth weight babies account for less than 12% of NICU admissions. This is not the majority of the babies. He's using a statistic that don't include the majority of the babies that would need these NICU services. They simply don't. I've included for you the state health plan because one of the things this COPA says is that this COPA does not allow them to operate outside of the Certificate of Needs. The Certificate of Needs says that you all have to comply, that the neonatal, the state health plan has 5 levels of principles for health care. It's access to care. They're in here. I want you to look at them when you have time, because this is not just about voting for a resolution against these proposed changes. This is voting on what you're going to do for the next 10 years while Ballad has a COPA, and whether you guys are going to hold them to oversight and review. Their COPA compliance monitor's name is Gary Miller. Guess what? He worked for Wellmont before this merger. He told me out of his own mouth he's pro-merger. And his employment is paid for by Ballad Health. Ladies and gentlemen, if I ask you, if I paid you to grade my papers, would you give me an A? Probably so. The state of Tennessee appointed Larry Fitzgerald to oversee the COPA for the state. Number one, they didn't even do that until May 16th. The COPA was issued January 31st. They went 5 months with no oversight from the state. And he only works part-time. I know, I've talked to him. What you currently have right now is an issue that has to be addressed. Janet Kleinfelter is the Deputy U.S. Attorney for the Public Interest Division. I talked with her yesterday at length. She needs your information. She needs your resolution sent to her. She needs documentation from the people that work for Ballad Health in your communities. This is something that is a fight, and it's a fight literally for life. I'm here because of the NICU. I'm not going to lie. I'm very I love those folks that gave me my grandbaby, so I have to love them. And I'm very grateful, and I'm grateful for your time. I gave you more stuff that I want you to look at that's specific to you. Because of your NAS rates, because of your mortality rates, I want you to look at those because I wanted you to see a picture for you. Your NAS increased 31%. Your NAS hospitalized babies increased 31%. The rest of the state only increased by 11% between 2016 and 2017. You have an opioid problem that's affecting your babies. And without a level 3 NICU, easily and readily available, more of your babies are going to die. I'm happy to answer any questions that you have.
Any questions for Ms. Cook? Yes, sir.
I'm assuming that NICU versus trauma centers, the levels are reversed.
Correct.
The level 3 is the highest.
So level 4 is the highest NICU designation. And
Niswonger.
Niswonger's a level 3 too.
Okay.
Niswonger's and Holston Valley are currently both level 3. The difference is Niswonger's has a children's hospital that stands separate from itself, which we do agree. Now, let me say this. For very low birth weight babies, you will get no argument from anyone who says those babies need to go to Niswonger. They do. The compromise would be to keep Holston Valley NICU operating at a level 2. And the reason why is as a level 2, it can support all of the NAS babies. You guys think you have a NAS problem? Sullivan County has 50.5 NAS babies per 1,000 births. It's like it's like 300% times the rest of the state. That NICU at Holston Valley Medical Center had 66 NAS babies admitted into that NICU between July of 2017 and June of 2018. 66 babies. A level 2 can care for our NAS babies and everybody that's 32 weeks and beyond.
Thank you.
Anything else?
Questions? Okay.
Okay.
Thank you, Ms. Cook. Thank you for being here.
Mr. Hernandez, can I have 1 minute?
Yep. Yes, sir.
That's
Come
all
forward.
I need.
Sorry, I was confused that initially I didn't realize all three were speaking.
Yeah,
I didn't catch it.
We're
That's me.
together. First of all, I was born and raised in Southwest Virginia. I've been involved in emergency medical services in one level or another for almost 30 years. We presented at the Scott County Board of Supervisors, and the important thing is for Southwest Virginia, I don't care what numbers or what statistics or what data Ballad gives you, people are going to die because of their decision to reduce Bristol Regional Medical Center to a level 3. So what we're asking Southwest Virginia to do is do what they've done best in the farming communities all their lives, and that's stand together. The Scott County Board of Supervisors passed a resolution opposing these changes. They also passed a resolution asking the Board of Ballad to leave Holston Valley and Bristol Regional Medical Center a level 2 facility and leave the NICU as a level 3. They also passed a resolution that they sent directly to the Virginia Attorney General's office and the Commissioner of Health, asking them to keep a very close eye on this. We're challenging this board to do the same thing. Stand with Scott County, stand with Wise County, stand with Buchanan County and Lee County, and do this right. Folks, your people are going to suffer. It's just plain and simple. They're going to suffer. A car wreck near the Smith County, Washington County line, you're looking at 70 miles to a level 1 trauma center. You're looking at 80 miles the other direction, 90 miles the other direction to a level 2. So folks are going to suffer in this area. And it's all about numbers. Why should we, as we are touting our counties and our cities to be progressive, why should we be regressive in our health care and go back to standards that we didn't have 30 years ago? It just doesn't make sense. So I'm going to present you that challenge. I'd like to thank you for your time. I know we went a little over. I'd like to thank you for putting us on the agenda and welcoming us in here tonight. Thank you.
Thank you, sir. Thank you for being here, Mr. Bradshaw. Okay, with that, we will move on to the next item.